Cancer diagnosis comes with hidden costs. What patients need to know. Imagine being diagnosed with cancer, only to find out that the financial burden of treatment could be just as devastating as the disease itself. This harsh reality is faced by countless patients every year, with out-of-pocket costs skyrocketing after an incident cancer diagnosis. But here's the shocking part. These costs can increase exponentially with the stage of diagnosis, leaving many patients with a daunting financial burden. According to a recent study published in JAMA Network Open, patients with private insurance can expect to pay a staggering $592.53 more per month for 6 months after diagnosis, with costs ranging from $462.01 to $719.97 per month, depending on the stage of cancer. To put this into perspective, the study, conducted by Liam Rose, Ph.D., and colleagues from the Stanford University School of Medicine, examined the out-of-pocket costs of 46,158 patients under 65, including 19,656 with cancer and 26,502 without. The results showed a significant increase in costs for patients with breast, colorectal, and lung cancer, with the highest costs associated with stage 4 cancer. But what's even more alarming is that these costs can have a profound impact on a patient's ability to receive timely and effective treatment. As the authors of the study point out, the variability in out-of-pocket costs based on cancer stage underscores the need for policies like paid sick leave and financial assistance to support patients, especially those with more advanced cancer. And this is the part most people miss. The financial burden of cancer treatment can be just as deadly as the disease itself, with many patients forced to choose between life-saving treatment and financial ruin. So what can be done to address this critical issue? Some argue that a more comprehensive approach to healthcare is needed, one that includes robust financial support for patients with cancer. Others believe that the current system is sufficient, but that more needs to be done to educate patients about the potential costs of treatment. But here's where it gets controversial. Should patients be expected to bear the brunt of these costs? Or is it the responsibility of the healthcare system to provide more adequate support? We want to hear from you. What do you think is the best way to address the financial burden of cancer treatment? Should patients be expected to pay out of pocket? Or is it time for a more comprehensive approach to healthcare? Let us know in the comments. As we continue to navigate the complex and often contentious world of healthcare, one thing is clear. The financial burden of cancer treatment is a critical issue that demands attention and action. By working together to find solutions, we can ensure that patients receive the care they need without being forced to sacrifice their financial well-being. Shocking truth. High out-of-pocket cancer care costs for privately insured patients. Cancer care expenses for individuals with private insurance in the U.S. are alarmingly high, especially for those facing advanced stages of the disease. But here's where it gets controversial. Despite private insurance coverage, many patients still encounter significant out-of-pocket costs that can strain their finances. And this is the part most people miss. These costs don't just affect the sickest patients. They start climbing immediately after diagnosis and persist for months. A recent comprehensive study has shed light on this issue, revealing that newly diagnosed cancer patients with private insurance experience monthly out-of-pocket expenses that increase by nearly $600 on average. For those battling stage 4 cancer, these costs jump even higher, reaching almost $720 per month. These numbers highlight the heavy financial burden borne by patients. Much of the past research has concentrated on Medicare beneficiaries, typically older adults, leaving a gap in understanding the challenges younger, privately insured cancer patients face. As cancer diagnoses among younger Americans rise, it's crucial to recognize that financial strain isn't limited to older populations. The research team analyzed data from 19,656 cancer patients, linking insurance claims from a major private insurer to the surveillance. Epidemiology and End Results, SEER, Cancer Registry. They focused mainly on breast cancer, 74.1%, colorectal cancer, 14.5%, and lung cancer, 11.4%. For comparison, 26,502 individuals without cancer were assigned pseudo-diagnosis dates to benchmark typical expenses, monthly out-of-pocket costs, including co-payments, co-insurance, and deductibles were carefully calculated from claims and adjusted for inflation to 2024 dollars. The findings are striking. After a cancer diagnosis, patients faced an average increase of $592 in monthly out-of-pocket expenses. Costs scaled with disease severity, from about $462 per month for stage 0 cancer to nearly $720 for those at stage IV. These expenses spiked sharply during the month of diagnosis and stayed elevated for at least 6 months afterward. Compared to people without cancer, this amounted to an extra $4,145 in total expenses over 7 months. The study authors emphasize the practical implications. Patients with private insurance incur substantial out-of-pocket costs following a cancer diagnosis, with those in advanced stages facing the greatest financial challenges. They argue that this variation in costs by cancer stage underscores an urgent need for supportive policies. Suggestions include paid sick leave and programs ensuring insurance continuity, along with targeted financial assistance, especially for patients battling advanced disease. However, the study has some limitations worth noting. Patients with stage 4 cancer were more likely to drop their insurance coverage, which may have influenced the results. Also, the analysis only captured direct medical costs, excluding other financial burdens like lost wages or travel expenses related to treatment. This research, led by Dr. Liam Rose at Stanford University School of Medicine, was published in JAMA Network Open. Funding came from the American Cancer Society, with some authors receiving grants from government health agencies. The article underwent thorough editorial review, including AI-assisted writing tools, ensuring a polished and accurate presentation. This study raises important questions. Are private insurance plans adequately protecting cancer patients from financial hardship? Should policymakers prioritize reforms to reduce out-of-pocket costs, especially for those with late-stage cancer? We'd love to hear your thoughts. Do you agree that more needs to be done, or do you see alternative solutions? Share your perspective in the comments below.